Hey there, viewers! Have you been feeling a little off lately? Tired? Legs in pain? Well, there could be a few reasons for this. One of them you probably didn't consider was poor blood circulation. This is nothing to treat lightly. Your body relies on good circulation in order to keep your organs supplied with oxygen. It can sometimes go ignored for years until it's no longer avoidable. Let's talk today about symptoms of poor circulation. Are you feeling pain in your feet? What about digestive issues? Wait a second, what are varicose veins? We're talking all that and more. Let's get varicose veins out of the way first. This is one of the more serious symptoms you're going to want to look out for. Varicose veins are enlarged veins caused by valve failure. You've probably seen them before. They appear twisted and bumpy, usually showing up on the back of the legs. Due to the damage, the blood can't move through the veins as quickly as it wants to, causing poor circulation. While they are a concern, some people won't end up getting them. Your genes are usually what determines whether or not you'll get varicose veins. Women are more likely to develop them along with obese people. If you're noticing varicose veins, you're gonna want to talk to a doctor ASAP. They'll find ways to treat it. If the varicose veins are way too damaged, they may perform laser surgery to remove them. You're gonna want this treatment if it's necessary. On rare occasions, varicose veins can cause blood clots. Actually, let's talk about blood clots next. Blood clots are clumps of blood that sometimes block blood flow completely. They can form almost anywhere on your body. If you've noticed gel-like colorful marks on your arms or legs, it's probably a sign of poor circulation. Your blood isn't pumping into your organs properly and needs to be dealt with. Blood clots can move from one area of your body to another. If they get into your heart or lungs, they can lead to a stroke. Luckily, a blood clot can be treated if it's found at an earlier stage. What the doctor will do is provide a blood test. This will check for something called D-dimer, which is a tiny protein fragment present in your blood during clotting. There's also something called peripheral artery disease, or PAD. This is a circulatory condition that causes your blood vessels and arteries to narrow. This happens because of plaque buildup. PAD can lead to poor blood circulation in your legs. If you're feeling stiffness and pain in your body, your circulation is probably poor. If PAD is left untreated, it could lead to a stroke. This is from all the plaque blocking your carotid arteries, the blood vessels that deliver blood to your brains. PAD will also increase the risk of heart attack as the heart is no longer getting the proper amount of blood it needs. If you're over 50, you're gonna want to look out for this. Middle-aged adults are much more likely to be diagnosed with PAD. Young people diagnosed with the disease are usually smokers or people who aren't taking care of their health. You'll also see a lot of numbness and tingling. This is usually in your hands and feet. When something is restricting blood flow, some serious pain is going to set in. It's going to feel like little pins and needles prickling your body parts. The pins and needles sensation is one of the most common signs of poor circulation. While it tends to come and go, the sharp pain around your hands and feet can be unbearable. It gets especially uncomfortable when you're doing a physical activity. Pins and needles can stop you from performing your daily tasks at work. If your job requires you to lift heavy objects or constantly move on your feet, bad circulation is going to get in the way of that. Outside of this numbness and tingling, you might feel overall discomfort. This includes things like muscle cramps, especially when it comes to the arms and legs. Muscle cramps can ruin your entire day. They make even simple everyday tasks feel impossible. You don't even have to be walking to feel the pain in your legs. You could be just resting in bed. If you're feeling this overbearing discomfort, it could be a sign of poor blood flow. This is usually accompanied by varicose veins. A person with poor blood flow may have some trouble walking. The discomfort your muscles are going through is just too much to bear. As a result, you're gonna feel weak when you're on your legs. This makes it so much harder to get around. People with bad circulation often require assistance to transport themselves, whether it's with a walker or a mobile cart. On top of the pain and tingling, poor circulation causes throbbing. If you're feeling this throbbing in your legs, chances are your body isn't getting the proper blood flow. If your legs are too swollen, doctors will prescribe you a special type of sock to help deal with the discomfort. They're called compression socks. This is one of the best ways to treat poor circulation. On top of that, experts will also give you a special exercise program meant to increase circulation and make it a lot easier to function. All this pain you've been feeling has made it harder to move. Oh yeah, on the topic of pain, a person with poor circulation is also going to be experiencing some wicked chest discomfort. This is called angina. Angina is the most common symptom of poor blood flow to the heart. As for the level of pain, well, that varies depending on who you are and how bad your circulation is. This next symptom is one of the scariest you'll experience. Have you ever noticed creepy skin discoloration on your body? Poor circulation can cause your skin to turn blue. You'll usually see it appear in patches. This discoloration is called cyanosis and is fairly common when the skin isn't getting the right amount of oxygen. Cyanosis is more than enough reason to book a doctor's appointment and figure out what's going on. Outside of strange colors on your skin, bad circulation will also bring on some really random sensations. Have you ever had cold hands for no reason? It feels like you've been outside on a winter day with no gloves, when really you've been in a heated room. Cold limbs can be really freaky, especially if you have no way to explain it. When your muscles put too much pressure on your arteries, it causes your blood flow to reduce. As a result, your hands become cold, specifically your fingers. If this is something you're feeling all the time, go and talk to a doctor. Not even the warmness of mittens will stop this. There's also something you should know about called Raynaud's disease. Constant coldness in the hands and feet could signal this condition. The small arteries in your hands and feet have narrowed, making it so much harder for your blood to move around your body. Outside of your hands and feet, other parts of your body can be affected by Raynaud's, like your lips, ears, nipples, and nose. Keep in mind, these places are rare and only some people will experience it, although this doesn't make it any less unpleasant. Much like varicose veins, women are more likely to experience Raynaud's disease than men. This is said to be because of the fluctuations in female sex hormones. There are a few ways to see if you actually have Raynaud's disease. A doctor will usually do an antibody blood test. This checks for all inflammatory conditions, including Raynaud's. Have you ever felt tired for no reason at all? Of course, people get tired for a million different reasons. Having a sugar-filled lunch can make you want to take a nap in the middle of the sidewalk. Well, you can add poor circulation to the list of causes. Poor blood flow can reduce your energy levels and bring on extreme fatigue. Seriously, you'll feel like you're ready to drop. This is all because the heart isn't pumping enough blood, making you feel exhausted throughout the day. So if you're feeling this level of tiredness, try not to rule out poor circulation as a cause. If you're experiencing many of these symptoms altogether, there is a chance you may have diabetes. Diabetes can cause poor circulation in various parts of your body. You will start feeling pain not only in your legs, but also your thighs and buttocks. If you are feeling pain in your legs, it will be concentrated mostly around the calves. This type of pain will make it a lot harder to be physically active. If you're starting to see varicose veins pop up while feeling pain, numbness, fatigue, and cold hands, poor circulation may be just one of your worries. You're also going to want to get checked for diabetes. When you get tested for diabetes, the doctor will do a test on your blood sugar. This will help them diagnose it. If it turns out you do have diabetes, the doctor will provide insulin and other medications to help treat it. From here, your lifestyle is going to have to change. You don't need full-on diabetes either. A person who's simply overweight can have poor circulation and not even know it. If you've noticed that you've put on a few pounds recently, your blood flow has probably been reduced. This is especially true if those extra pounds are fat. Chances are your diet is causing your arteries to clog up, making it that much harder for blood to flow. Being overweight or obese increases your risk of not only bad circulation but also varicose veins. Poor blood circulation is life-threatening. Remember, make sure you see a doctor if you're experiencing any of these symptoms. It could be all that stands between life and death. Let's keep the conversation going with a couple more health-related videos, shall we? Here's what you should know. Check out 15 signs of heart disease you shouldn't ignore. Or how about foods that can clean your arteries and prevent a heart attack? Go ahead, click one, or better yet watch both and learn more about how to improve your heart health. Have you been suffering from poor circulation? Let us know in the comments below.